passion is taking care of people who are going through stem cell transplant. So a stem cell transplant, that's when you get, used to be known as bone marrow transplant. And this is where you get blood, a new blood system and a new immune system from a donor. And it's used for the most part as a treatment for people with advanced blood cancers that are impossible to cure any other way. Cancer is terrifying, and especially in the blood cancers, the challenge is that they're very unfamiliar, right? So there's 10 times more cases of lung cancer than there are of multiple myeloma, let's say. Not only are patients scared because they've realized that they have this diagnosis, but they maybe don't know anyone else who's ever had this. What I find is the most helpful for patients is to talk about other patients who've gone through what they've gone through. I always bring up when I see a patient with multiple myeloma, I always talk about this one patient of mine. He's just a great guy. He's loves serving other people and serving the community. And he comes in once a month and he gets his multiple myeloma treatment, and then he's back out living his life, and doing what he loves. I love talking to my patients about the success stories. Even though you have this diagnosis, we've got treatments, and our goal is to get you back to living as close to a normal life as we can. There are therapies now where we can take a patient's T cells, their immune cells, and we hotwire them to go after the cancer cells instead of going after germs and doing all the normal things that T cells normally do for you. These so-called CAR T cells have delivered dramatic responses in patients who had pretty much exhausted the normal therapies that we have. So that gives great hope. If you think about where might we be in 50 years, there's an area of research that's just in its infancy right now, and that's cancer prevention. So cancer prevention can include things like teaching people better lifestyle choices, not smoking cigarettes, but it goes beyond that. What we've learned over the last 10 years about why cancers happen, blood cancers as well as other kinds, is that they're due to genetic damage. Over time, you get damage to your DNA, and it can affect genes. And if you have bad luck and it affects genes in a sequence, then it turns into some kind of cancer. Over the last 10 years, we've been able to identify almost all of these genes that are involved in blood cancers. So now the challenge is to try to see, is there something we can do maybe after that first gene happens before it turns into cancer? Is there some intervention that can be made to prevent this from turning into a leukemia or a lymphoma that would need some treatment? That would be the best way to take care of cancer altogether, is to prevent it from happening. I wasn't sure what specialty I was going to go into until I was a resident, and I worked on the inpatient. I worked for a month on the inpatient bone marrow transplant service, and I just fell in love with it. I have always had an interest in sort of the sciencey side of medicine, and there's nothing more nerdy and sciencey than stem cell transplant. Taking all of the blood system out of one person and putting it into another person. That aspect I love. But the other aspect I love, I love about transplant, is that when you get a transplant, you're in the hospital for about 4 weeks. That's if everything goes perfectly. And you get to develop a relationship with the people in the hospital. When I have a patient who gets a transplant, after they get out of the hospital, I see them every week at the beginning. They're coming into clinic weekly to see me. And so I get to know you and I get to know your family. And there's just a relationship that you develop with patients and your families that other doctors don't really get to make. So that's the other side of it that drew me in, and that makes me happy in my job. Well, there's a lot of good places to get cancer care in St. Louis and around the United States. Siteman is special in part because of this long research tradition, right? So through the affiliation with Washington University, we have a big research arm. We've got a lot of clinical trials. We're constantly trying to push the envelope, get new treatments, get better outcomes for patients. But the other thing that's great about Siteman is there's a high level of professionalism, whether it's the medical assistant or the people who answer the phones or the nurses. I find that the people who we work with who are part of Siteman are highly professional and really interested in going above and beyond. It's not just a job. They really want to help people through this difficult time.